Hi everybody, welcome to this class on forensic medicine and toxicology. So today we'll be discussing the topic medical legal aspects of wound and thermal injuries. Coming to the important questions in this chapter, we have long essays. Under long essays, we have the first question, define wound, cause of death from wound, and we have to distinguish between antemortem as well as postmortem wounds. The second question would be define burns, the types of burns, classification with its medical legal aspects, and its treatment, management, and causes of death due to burns. So these two are the long essays that we'll be discussing today. Apart from this, we have short essays, difference between antemortem and postmortem burns, a pugilistic attitude, rule of nine, and filigree burns. These are the short essays, and we also have certain shorts like dowry death, grievous hurt, as well as death in custody and suicidal custody. So these are the questions we'll be discussing today. Now coming to Auricle, what is Auricle? Auricle is a platform where you have a lot of things like recorded classes, live classes, practical sessions, exam module, as well as hard copy book set. So all of these is available in a single platform. That is how it is going to help all the medicos in preparation. Coming to the foundation classes, so foundation classes are curated in such a way that it offers flexible learning experience to each and every student who is using it. So the student can use the app at the comfort of their home or anywhere they are in, and they can go back to the foundation pre-recorded videos and watch them a number of times if in case they have any doubts. So that's why it is also going to offer them a convenient tool for revision. Coming to the live classes, so live classes are curated in such a way that previous 10-year questions are taken and from which most anticipated questions are chosen and explained to the students in a way where answer writing skills, the concepts, study plan, everything is given to students so that their work is going to be much more simpler. These are going to be interactive learning sessions where there is also doubt clearing sessions, MCQ polls, Viva OC, and so many more, which will aid in helping students prepare for their theory exams well. Coming to the express exam module, here the complete syllabus is covered in less than 20 hours, and this applies for each and every subject of MBBS. So it's going to give you a comprehensive as well as efficient coverage of the syllabus. Here we are going to even tell you about how you need to put in diagrams in your paper, flow charts, so that you can score better. And here the educators are also going to give you study plans which you can follow in order to study thoroughly. Apart from this, we also have one-to-one doubt clearing where a student-centric approach is taken. Every student's need, no matter how small or big the doubt is taken care of, and a personalized attention is given to the students in one-to-one doubt clearance session. Apart from this, we also have hard copy notes. The in-depth coverage of every topic is done. Previous 10-year questions are also given extra importance. Also, a lot of images, flashcards are there in these books so that it's going to help students develop that pictures view memory so that it is easier for them to recall during exams. We also have question bank, and these question bank contains 3 level of expertise, and we have a level beginner up to the expert level. And the good thing about these question banks is that it is customizable. Because it's customizable, you can select whichever topic you're studying and you can solve questions from that topic so that it is going to be an active recall of whatever you have studied. So these MCQs are going to cover MCQs for prof exam, NEET PG, as well as FMG. Coming to the practical sessions, so in the practical sessions you're going to get hands-on experience, and all these clinical scenarios are done in such a way that it is going to be in an interactive session format so that people can enjoy watching all these videos. And here we'll also give importance to the Viva OC questions, as well as spotters are given extra importance so that you don't miss anything before going to your practical sessions. Coming to the different subscription plans that are there at Auricle, we have Foundation Plan, Advanced Learning Plan, Complete Learning Plan, as well as Ultimate MBBS Plan. Hello.
Yes, ma'am.
Now is it fine?
Can you share your screen, ma'am? And you are not visible, so can you open
Yeah,
your
yeah,
video cam also?
yeah.
Hmm.
Now see if it is fine or not.
Yes, ma'am.
It's fine. Okay. So we should start again from first, is it?
Your wish, ma'am.
Like otherwise, from which slide I should start?
Practicals.
Okay, okay. From that slide only we'll start.
Yes, yes, ma'am.
Okay, okay. 1 second. So now coming to the practical sessions, in practical sessions, you're going to get hands-on experience about the various clinical scenarios that will be asked in your practicals. Apart from this, we'll also give you a fair insight as to what questions are asked in the Viva VOC, as well as we'll be touching on spotters. So we're going to give you various spotters that can be asked, also the questions that are asked regarding the spotters. And this practical sessions is going to be like engaging interactive sessions so that it is going to benefit all the students who are watching practical sessions. Coming to the different subscription plans that are there, we have a foundation plan, advanced learning plan, complete learning plan, as well as ultimate MBBS plan. Coming to the foundation plan, we have pre-recorded classes, live classes, express exam module, practical session, as well as Q bank. So these 5 features that I explained to you already in brief are going to be there in foundation plan, and this is for a duration of 3 months. And also we have advanced learning plan, which is for a duration of 6 months, where you have similar things like pre-recorded classes, live classes, express exam module, practical sessions, and Q bank. Coming to the complete learning plan, apart from all that I mentioned earlier, you also get hard copy note set as well as one-to-one doubt clearing sessions. So the whole sum of this is available to you in the complete learning plan. Coming to ultimate MBBS plan, as the name suggests, it is there for 4 years. So you're going to be covered through and through your MBBS, where you get all these features, and it is for 4 years. So these are the various subscription plans that are there at Auricle, and you can use my coupon code Dr. Additional discounts on your subscription. Now, coming to the topic per se, we'll be discussing about medical legal aspect of wounds and thermal injuries. So there are a lot of 10 markers that are important from this chapter. Also, there are a lot of Viva, OC, and MCQ questions that can come. So we will dive into the topic and look at all the important questions. So firstly, coming to the question of define wound, cause of death from wounds, and to distinguish between antemortem as well as post-mortem wound. So when you come to this question, it has so many subparts, no? So the definition would carry 2 marks, and both the other subparts would carry 4 marks each, adding up to 10 marks. So coming to the definition of wound is a very simple definition, and if you write it properly, you're going to get all at 2 marks. So wound is nothing but damage to any part of the body due to application of mechanical force. So mechanical force is the cause of a wound. This mechanical force is going to cause a damage in the body, and this is nothing but wound. Now, coming to causes of the death from wound, coming to causes of death, there are 2 types of causes. Okay, there is immediate cause and also remote cause. Coming to immediate that causes death as soon as a wound is inflicted on the person comes under immediate cause. So if the death occurs after a period of time, let's say for a week, then it will come under remote cause, because there is a time gap between the wound and when the death of the person happens. Now coming to immediate causes, the number one, we have hemorrhage. So what is hemorrhage? Hemorrhage means nothing but bleeding. So when there is a wound, there could be bleeding from the site of wound, arterial or venous bleeding. It could be primary or secondary. What is primary? Primary means immediately whenever there is a wound, there is bleeding. Secondary means bleeding happens after a period of time, let's say 3 to 4 days. Then it is called as secondary bleeding. Okay. Then death could also occur because of reflex vagal inhibition. That is, whenever there is wound, the body is in a state of shock, and because of which there could be vagal inhibition. All the functions of vagal nerve is stopped. That is also a reason for death immediately. The third reason is shock. There could be different types of shock because of reduction in blood volume. This is in continuation to the first point that we discussed about hemorrhage. Whenever there is a lot of bleeding, there is decrease in blood volume. It could also result in shock. There could be some other type of shock like traumatic shock, cardiogenic shock, septic, as well as surgical shock. So these are also various other immediate causes of death from wound. There could also be mechanical injury, nothing but a physical injury to a vital organ, for example, kidney, liver, or heart. So when these organs are damaged, even then there could be immediate death that happens in the person. Now, coming to the remote causes, for example, we have infection. That is, after a person gets a wound, if it's not infection happening at the wound site, and that could act as a remote cause of death. There could be gangrene or necrosis that is happening if immediate medical intervention is not planned. Even then, there could be necrosis. Whenever there is gangrene or necrosis of the muscles, there is going to be breakdown of the muscle fiber. What is a muscle fiber? The muscle protein, it is nothing but myoglobin. So whenever there is breakdown of myoglobin, it is going to go to the kidney, and it is going to block all the tubules in the kidney, causing acute tubular necrosis. So when there is acute tubular necrosis, in other words ATN, it is going to hamper the function of the kidney, causing renal failure. So this could also be a remote cause of death after wound. And if the person is neglected, is not taken proper care of, it doesn't get any medical attention, that could also be a cause of death. So these are the various remote causes. So repeat remote causes are nothing but infection, gangrene, necrosis, renal failure, and neglect of the injured person. Coming to some other remote causes, there could be some disease of the person, and he might have it inherently. That is, the present wound is going to aggravate it. For example, aneurysm, fatty degeneration of heart. Whenever there is extra strain or stress for the person, all these conditions are going to get aggravated, and because of and it can contract and produce complications. For example, if there is a big injury, for example, a laceration in the arm, whenever it is going to heal, it is going to produce a contraction around the arm. So when there is contraction, if the fibrous scar that is formed is too tight, it might press upon on the muscles and the nerves that are there and hamper the functioning of the arm. This way, a fibrous scar might produce contractions and cause further damage. There could be thrombosis and embolism which develops in all the bigger arteries, for example, femoral, popliteal, or the posterior tibial artery. And this embolism or thrombus can travel through the circulation, go to other vital organs, like, for example, brain, block a vessel there, and might cause death of the person. The another reason under remote causes nothing but fat embolism. So whenever there is a long bone fracture, for example, a femur fracture, there might be a lot of fat globules that are released, and this can go in the circulation and can block the distal circulation and cause death of the person. So these are the various remote causes of death. What is the amount of air in an embolism required to cause death? It is nothing but 100 ml. Whenever there's 100 ml of air under pressure, that would cause pulmonary embolism and even kill the person. Sometimes what happens whenever there is these air embolism, and if it goes to the pulmonary circulation, it can also cause diffuse alveolar damage, DAD, and that could also be a cause of death. Okay, and also there could be coagulation failure that is happening. Whenever there is coagulation failure that is happening, even then the person can die. And coagulation failure can occur mostly because of some infection, because infection could supervene on the trauma, and that could act as the cause of aborted and retracted. Why there is retraction? Because here all the enzymatic process, the body is active, no? So when the body is active, it is going to retract and pull the fibers apart from the wound. Therefore, there's going to be gaping that is seen at the site of wound. Now, coming to post-mortem wound, because there's no active metabolism happening, all the functioning of the muscles are lost, because of which there won't be any retraction. In fact, when you look at the wound, it is going to be properly approximated. They're going to be near each other. Now, coming to hemorrhage, there is going to be abundant hemorrhage in antemortem wound, because all the and it is usually arterial hemorrhage that is seen during antemortem wound. Now, coming to postmortem wound, the hemorrhage is going to be slight, okay, because as I told you, all the metabolic functioning of the body has stopped. Now, coming to spotting, as I told you, whenever there is antemortem wound, it is arterial bleeding that is seen. And whenever there is arterial bleeding, there could be spotting that is seen. Because we already know that it is arterial bleeding that is always going to spot out, and venous bleeding isn't going to spot out. Therefore, because the postmortem wound is venous in nature, it is not going to be spotting. Coming to extravasation, staining of the edges of the wounds is seen in case of antemortem wound, and this staining is going to be fixed. Therefore, when you try to wash it off in an antemortem wound, it is not going to go. Whereas now coming to postmortem wound, here it is not going to be deeply stained. Therefore, if you try to wash this wound, you can wash it off easily and it will look like normal. Coming to coagulation, because in antemortem wound, the person is already living, the coagulation process is going to start and there is a wound or scab that is formed. Whereas in postmortem wound, there won't be any clotting that is seen. And coming to the vital reactions, all the vital reactions, like for example, inflammation, repair, everything is going to be active in case of antemortem wound. And coming to postmortem, there won't be any signs of vital reaction because all the functioning, the vital functioning of the person has stopped. Coming to the enzymes, there could be various enzymes like adenosine triphosphate, aminopeptidase, acid and alkaline phosphatase, whose levels can be checked, whose level will be raised in case of antemortem wound, whereas in postmortem, their activity is going to be diminished, or the activity, you can say that their activity is nil. So these are the various differences between antemortem as well as postmortem wounds. Okay. So remember, three major differences would be: one, there is going to be gaping and retraction and swelling seen in antemortem wound because of the activity which is still present. Number two, there is going to be staining that is seen and the staining is going to be fixed. Number three, all the enzyme levels are going to be more in case of antemortem wound. Now coming to the question of dowry death. So what do you understand by dowry death? In some cases, newly married girls are abused, harassed, or cruelly treated by husband or in-laws in order for seeking money or any other royalty. So this is nothing but a case of dowry death. Okay. So in extreme cases, the woman is killed by burning or some other method. This is the definition of dowry death. Now, coming to the different sections that apply for dowry death, there is section 304B of IPC, which says that dowry death shall be punished with imprisonment of not less than 10 years, but which may extend to life imprisonment. So, depending on how cruelly the lady was killed, there could be increase in the tenure of 10 years to up to life imprisonment. There is also one more section of CRPC that applies for dowry death. It is nothing but section 174(3) of CRPC. Here you have to understand that whenever there is IPC is going to tell you what is a punishment, and CRPC is nothing but it is going to tell you what is the procedure of the punishment. Okay, so the procedure of punishment in the dowry death is given by section 174(3) of CRPC. This is what you'll have to write whenever a question of dowry death is asked, and even in your viva they might ask you what are the different sections pertaining to dowry death. They are section 304B of IPC as well as section 174(3) of CRPC. Now coming to the next question of grievous hurt. So what do you understand by grievous hurt? Grievous, as a name suggests, grievous means of serious nature is called as grievous. Okay? So initially it came under section 320 of IPC. Now entire IPC sections are changed into BNS, no, Bharatiya Nyaya Sanhita. So under BNS, grievous hurt comes under 116 of BNS. So there are different examples which come under grievous hurt. They are emasculation, permanent privation of sight of either eye. That is, they will lose sight of either of their eye. Permanent privation of hearing, that they'll lose the capacity to hear. Privation of any member of the joint, that is, one of the joints is dislodged in such a way that they will not be able to. Or there could be destruction or permanent impairing of the power of any member of the joint. Permanent disfigurement of head or face. Remember, whenever there's a disfigurement of head or face, especially in those people who are involved in cinema or media, news anchors, or somebody whose face value is going to represent a lot, in those cases, the punishment of grievous hurt is going to be even more. Fracture, dislocation of a bone or tooth. And another example is any hurt which endangers the life of a person and or something that could cause severe bodily pain to that person, because of which he'll have to halt his day-to-day activities by 20 days. Then also it is called as grievous hurt. So these are the various examples where section 116 of BNS is applied, and all these come under grievous hurt. Now, coming to the next question, death in custody and suicide in custody. Now, what do you understand by that? Means any death happens whenever a person is in detention in the custody is called as death in custody. It could be in a police cell or in a prison. Okay, so the death occurring at the time of custodial detention is nothing but death in custody. So any deaths which happen in the presence of police or prison officers, or whenever they're trying to detain a criminal, at that time if there is death happening, or if that person whoever has detained tries to escape from the prison, even then if death occurs. So all these are the various types of deaths that come under death in custody. Coming to deaths during arrest, so what could be the causes of deaths occurring during arrest? One is traumatic asphyxia. So what do you understand by asphyxia? Asphyxia is when the person has breathing difficulty to such a level when his oxygen saturation in the body could go down to as low as less than 50%, and he might die. So this is one of the reasons for death. And during arrest, it would be traumatic asphyxia. That means a trauma resulting in asphyxia. So when could that happen? Because whenever a lot of policemen try to fall on the person, maybe the person was trying to escape and a lot of policemen try to fall on him in order to prevent him from escaping, and because so many people have fallen on his chest, his respiratory movements are hampered, and because of which there could be traumatic asphyxia and he could die. If there is a struggle, blunt injury sustained by the offender by the use of fist, arm or leg, riot stick, etc. by the police, or from head injury from falls against ground wall may cause death. So these are also the various causes, like something that the police use in order to sustain the offender. For example, a riot stick could cause injury and there could be death, or whenever the person is pushed, he might fall on the ground or wall, and sometimes when the impact is too much, there could be severe head injury, there could be intracranial bleeds, and they might die. These are all the rare circumstances, and all these come under the death during arrest. Coming to one more reason, death could occur during hawk time. So what is hawk time? It is for physical strained in a prone position. So what do you understand by prone position? It is nothing but a head down position opposite of supine. So whenever he's lying in a head down position with his wrists and ankle bound behind his back and secured with a cord. So the person is going to lie like this, and both his hands and the arms are going to be secured. So this black thing that I'm showing is a rod. Okay, so his hands and legs are going to be tied like this. So in such cases, there could be asphyxia that is occurring because the person has difficulty in breathing, and later he becomes unresponsive and he might die. So this is also one more reason which would cause death. Or the death could occur because of a choke. The custody. Usually in custody happens, the number one method by which it occurs is by hanging. Okay, sometimes poison may be consumed here. Usually what happens, they will not have easy access to poison. That is why hanging is one of the easiest means used by all these people in custody in order to commit suicide. They might even jump from a height, cut his throat, or a very large blood vessel, because of which there could be a lot of bleeding, and finally there could be death of the person. Death might also occur by certain natural causes. So we should not neglect the natural causes. There could be certain cardiovascular diseases which could cause death. That is, a person because of extreme stress could die out of a heart attack. The emotional upset may precipitate an acute cardiac crisis in the presence of pre-existing disease. So these are the various causes. So when you have to answer about suicide in custody, you have to always make note about the cases in which the person tries to die by himself. For example, hanging, committing, jumping off from a height, or even cutting a blood vessel, for example, a bigger blood vessel like a carotid, or by natural causes, for example, a heart attack. So these are the various causes of death in custody. Now, coming to the chapter of thermal injuries, the number one question we'll be looking into is medico-legal importance and its treatment and management and causes of death due to burns. Now, firstly, coming to burn injury, what do you understand by burn injury? So, a burn injury is an injury which is caused by application of heat or chemical substances. So, we need these heat or a chemical substance. For example, something like a KOH or NaOH. So, these are the caustic alkalis which could cause burn. Or burn can occur because of the process of conduction or radiation whenever there is excess heat that is there. Or it could occur because of any external or your internal injuries that are occurring because of a fire. So these are the various things that could cause death in case of a burn injury. And whenever there is burn injury, apart from the superficial injuries that you can see, there could be extensive soft tissue injury inside the body as well. Now, coming to the characteristics, there are different types. Okay, we have contact burn, we have flame burn, flash burn, and even scalds. Now, coming to contact burn, when you come in contact with a hot solid or a molten metal, there are a lot of blisters that develop on the skin, and also there is erythema. What is erythema? Erythema is nothing but redness around the surface of the blister. So this is nothing but contact burn. The skin comes in contact with one of these hot metal, and you get blisters and erythema. This is nothing. If I have to give you a simple example, when you touch a hot vessel in your kitchen, you get that redness and blister on it. This is nothing but contact burn. Then we have flame burn, where you come in contact with a flame. There is going to be vesication. So small vesicles, the fluid-filled cavities are formed on the surface of the skin. There's going to be singeing of the hair. That is, whenever hair burns, is that peculiar odor to the hair and becomes brittle. No, that is called as singeing of the hair. And even there is blackening of the skin. Next, we have flash burn. Flash burn is also a type of flame burn. That is, you get burnt by the flame itself, but it's as the name says, it's flash. No, flash means there is sudden ignition or explosion of the gases, because of which there is burn. Okay, and also we have scars. Scars means it is a type of burn, but here the burn occurs because of exposure to hot liquids. So whenever there is exposure to hot liquids, there is going to be scars that are seen. Apart from this, we also have radiant heat burn, which is caused by radiation. What radiation? Radiation, EM radiation, is going to cause radiant heat burn. And here there's no contact with any sources. It is just the radiations that are coming and causing the burn. Here also the skin is going to be erythematous. It is going to be red and blistered, and it is also going to look light brown in color, and it also has a leathery, waxy appearance of the skin is noted. There is also ionizing radiation burn, where there is localized or generalized redness because of skin irritation. There is going to be dermatitis, and in the later stage, when there is healing, this ionizing radiation burn are going to show some pigmentation at the area of contact. Okay, coming to chemical burns, what are the chemicals that could cause burn? Any acid, like for example HCl or H2SO4, or an alkali like KOH or NaOH. So these are the things that could cause chemical burns. And in chemical burns, remember that there's going to be distinct coloration seen, but remember there is no singeing of the hair is seen. Where singeing of hair is seen? Singeing of hair is seen in flame burn or flash burn. Coming to microwave burn, here there is going to be greater water content of the tissue. Here you have to understand that in microwave burn, if there is more water content, it is directly proportional to the heat production, and greater is going to be the damage. Okay, so this is what you have to understand in microwave burns. Now, there is a classification called as London Brown classification. Here, this is going to be applied for the infants. Okay, so in infants, whenever the head is involved, we are going to take it as 18%, and each leg is counted as 13.5%. Okay, so 13.5 for each leg. So together, it is going to be 27%. Trunk and the upper limb is going to be same as adult. So I'll be explaining that in the later question. So this is how we are going to calculate for an infant, and the name of the classification is London Browder method. For each year above 1, add 0.5% to each leg and reduce 1% to the head until adult values are reached. So this London Browder method is a little complex method, and that is why people tend to not ask you, because it is a little complex thing. Remember, it is going to be used for calculating this burnt surface in an infant. Now, what are the causes of death in case of burn? There are immediate causes. He is going to be in a lot of fright and pain. So because of this fright and pain, there is going to be activation of the sympathetic system. So whenever there is activation of the sympathetic system, the person might go into a neurogenic shock. That is one of the immediate cause of death. There be asphyxia. So whenever there is burn, there is a lot of unburned carbon that is there, because of which the oxygen available for the person is less. He might suffocate and go into asphyxia and die. There could be a falling of any masonry or timber on the body, and that could act as a mechanical injury and cause of death. Also, there could be vagal inhibition. I told you, whenever there is a situation where the person is under too much stress, there could be inhibition of the vagus, because of which there could be cardiac arrest. So what is the normal function of vagal nerve? It is nothing but to increase the heart, increase the rest and all. So whenever there is inhibition, there is going to be stoppage of the functioning of the heart. There is going to be cardiac arrest. So these are the various immediate causes of death. Coming to the delayed causes, there could be hypovolemic shock. That is, eventually from in the body every day there is going to be little fluid loss, and when there is fluid loss, there is going to be hypovolemia in the person, and this is going to cause death. And whenever around 15% of the total body surface area of the person is burnt, it could cause a circulatory collapse in the person. Also, there could be renal failure. How renal failure? As I explained to you in the previous question, there could be myoglobin that is released from the muscles. This myoglobin is going to go and block all the tubules in the kidney functions hampered. There's going to be kidney failure. There's going to be oliguria. That is, the person is not going to urinate. There's going to be zero passage of urine, oliguria, then the person might die. So this happens after 3 to 4 days. Therefore, kidney failure is going to be a delayed cause of death. Now, coming to some of the other causes, we have toxemia. What is toxemia? Is whenever there is burn injury, the absorb various metabolites that are formed from the unburnt tissues, and because of which there is going to be toxemia, and this happens in 3 to 4 days. There could be sepsis. That is, severe form of infection would cause sepsis. And whenever there is inhalation of the irritant smoke and hot gases, there could be damage to the windpipe, there could be damage to the trachea and all the bronchi, and it could also cause death. And there could be hypovolemia. Why hypovolemia? All the muscles are damaged, all the potassium is taken into the cells. There is going to be less potassium in the circulation, because of which there is going to be hypokalemia, decreased potassium level. Other cause of death is nothing but a pulmonary embolism because of DVT, deep vein thrombosis. Or thrombus develops or an emboli develops. It is going to go all the way up to your pulmonary circulation, your lungs. It's going to block the circulation, and the person might die. So these are the various delayed causes of death seen in the person. Now, coming to the post-mortem appearances, before of the body, after which you have to take proper clinical history regarding what was the circumstance of death. So once you have done both of these, you have to also take an X-ray, because when you take an X-ray, it will help you rule out the presence of any bullets, lead shots, or any other fracture which was done ante-mortem, any ante-mortem fracture, stab wound. So you could see all these in an X-ray. So what happens when a burnt body comes to you? It is very difficult for you to externally look at the body and suggest whether any thing was a cause of death. Therefore, taking an X-ray, a virtual method of taking an autopsy, would help you understand all these findings better. Coming to the external findings, you have to look at the clothing. You have to see what type of clothing he was wearing, because there could be more ignition of the cotton fabrics compared to any other fabrics. If there is a loose, long garments which are very flowy, that would catch fire easily than any other tight fitting cloths like a button collar or a belt. You have to also examine the presence of smell of any kerosene or petrol, because that could aggravate the fire. And whenever there is a person who has died because of fire injury, you can see that the tongue has protruded, and there is going to be contraction of the muscles of neck and face. There is going to be a typical staring appearance of the face region of the person, and there is also going to be froth seen around the mouth and the nose. Why there is froth seen? It is because of the pulmonary edema and congestion. So why there is pulmonary edema? Because whenever the person is trying to inhale, because there's a lot of unburnt material, there's a lot of carbon monoxide in the room, when he inhales, the oxygen saturation comes down, because of which there is irritation of the air passages, which could lead to pulmonary edema. And as you all know, whenever there is pulmonary edema, a lot of frothing is seen around mouth as well as nose. So apart from this, when you look at the cornea of the person, because it is burnt, it is going to have whitish translucent appearance. So these are the various external post-mortem findings that you will be looking for when you get the body. Apart from this, when you look at the lens of the person, it is going to look opaque because it is burnt. Skin has a marbled appearance. Why there is marbled appearance? Because of the standing out of the superficial veins. So it gets fixed to the skin and there is staining and there is going to be a marbled appearance which is seen on the skin. Hair is going to be singed. As I told you, what is singeing? Singeing is that peculiar burnt odor of the hair. The hair is going to be tangled and easily pluckable because of resolidification of the keratin. And whenever you touch any part, like for example a hand, the skin can be easily detached from the hand, and the color of the body is going to be cherry red. Why the color is going to be cherry red? Because of the formation of carbon monoxide. So you have to always remember the different colors of the body. Like for example, poisoning with carbon monoxide, the body is going to look cherry red in color. These are the various hypostasis colors that you have to know, and these can come for your MCQ exams as well. So whenever there's an antemortem burn, that is the person underwent a burn injury before he died, there is going to be hyperemia of the body, that is increased temperature of the body. Also, there are going to be a lot of blisters seen on the body surface. So what are these blisters? Blisters are nothing but the fluid filled areas that are there on your skin. Okay, sometimes it could involve a smaller area and it will be unruptured, but in cases of severe burn injury, a lot of blisters can be there and it could be ruptured, and you can see fluid oozing out of all these blisters. Now, coming to next question, we'll be discussing about difference between antemortem as well as postmortem burns. So coming to the antemortem burns, the number one, time of occurrence. So ante, as the name suggests, no, ante, what do you understand by antemortem? It means before death. Postmortem means after death. Therefore, time of occurrence of an antemortem burn is before death. And because the person is still living, all his inflammatory response, everything is still active. All the vital reactions are active, because of which there is going to be redness, blistering, as well as swelling seen. Coming to the postmortem burns that occur after death. And why it could occur after death? Whenever the body after the person died comes in contact with the fire, there's exposure to fire. In such cases, a postmortem burn is seen, and here there won't be any inflammatory responses, because basically the metabolic activity of the body becomes zero. Skin may appear charred, that is, it is going to look black, dry, and there won't be any inflammation. Coming to the healing signs, in an antemortem burn, there it might show signs of healing. Like for example, scabs might be seen, new skin or scar tissue might be seen. Whereas in case for postmortem burn, there won't be any healing process that is seen. Coming to an antemortem burn, the patient experiences pain because of nerve activity. That is, whenever there is burn, it is going to hamper, it's going to affect the nerves. The nerve endings are destroyed, because of which there could be pain. And in postmortem, there won't be any pain, because all the nerves are basically dead. There's no functioning in the nerve, because of which there won't be any pain. Coming to the tissue involvement in an antemortem burn, it involves a deeper tissues, including muscles, bones, and all. And it depends on severity. For example, if it is a flash burn, or if it is if it's a flash burn, it is going to affect only the superficial layers. Whereas if it is a deep burn, a third degree burn or a fourth degree burn, it is going to affect all the internal deep structures like muscles and bones. But coming to postmortem burn, only the superficial layers, like for example, skin and the external tissues, are going to be affected. So these are the various differences that you have to know between antemortem and postmortem burn. Now, coming to pugilistic attitude. So what is pugilistic attitude? Let us look into one of the image first. Okay, this image of this boxer that you can see here, no, where he is standing with both of his arms, upper limb and lower limb flexed. This is nothing but pugilistic attitude. So when a dead body, a burnt body, is usually going to look like this. Hence, it is also compared to that of a boxer's attitude. Okay, so the other names are boxing, fencing, defense attitude. It occurs because of heat stiffening, and it is seen in case of burn injury. So this can come as your MCQ. Where is pugilistic attitude seen? It is seen in cases of burn injury. So what are the features? Remember, his legs are flexed, hips are flexed, and then his arms are going to be flexed at the elbows. So basically, there's going to be flexion at the elbow joint as well as knee joint. Okay, and his fingers are going to be hooked or clawed, like how you can see the fingers of the monkeys or chimps, no, like that. The fingers are going to be hooked or clawed. Head is going to be extended, it's going to be bent a little, and then there is going to be contraction of the paranasal muscles, all the muscles near the nose area, no, this around near your cheeks, these are going to be contracted, and this action where his paranasal muscles are contracted is called as opisthotonus. Apart from which the muscles contract due to coagulation of the muscular protein and dehydration. So basically this contracted look, as you can see in the image, where there is flexion at the elbow joint, flexion at the knee joint, muscles. This called pugilistic attitude. Got it? Okay. Now coming to rule of 9. What do you understand rule of 9? That you're trying to play the bodies involved case of one, apply something called rule of 9, where head is given 9%, each of the limbs, upper limb is given 9%, front of the body, back of the body, like the thorax, front and back is given 9 each, and the abdomen, front and back is given 9 each, and the groin area is given 1%, and the limbs is given 9 for the upper, in the lower limb, for the thigh region you have 9 and 9, and for the lower limb you have 9 and 9. So together there are 11 nines, and this 11 into 9, it is going to come up to 99%, and plus 1% is for groin, which sums up to 100%. So depending on how much surface of these, like for example, if there is involvement of the head, you are going to count it as 9%. This way you're going to sum up everything, add everything, and calculate how much percentage of the body is burnt. So this rule of 9 is also called as Valley's rule of 9. So what is the one more thing that we saw for the infants? It's nothing but Lunn-Broader classification, which is a little complex one. And with each age, with each increase in each age, the classification changes. Like for head, the surface area, initially we consider for 1 year as 18 and it comes down. Whereas for the arms, it is going to go up. It is a little confusing classification, but Valley's rule of 9 is a very simplified classification. And for Lunn-Broader, as I told you, from the, therefore, Lunn is not, it's different, 2 years different, 3 years different. It is very difficult for you to buy out everything. Therefore, remember this logic. For each year above 1 year, add 0.5% to each leg and reduce 1% from the head until the adult values are reached. Adult values, when does it reach? At 18 years. So remember what is the classification at 1 year, and add 0.5% with each to leg at each age, and reduce 1% to head with each passage of age. Now, coming to the next question on filigree burns. So, what do you understand by filigree burns? Filigree burns are seen during lightning injury. So, the burns that are seen on the surface of the body during lightning are called as filigree burns. So, whenever there is lightning, this lightning can kill a person because of a direct strike. Okay, that is, there could be a side flash, because of which there could be conduction of electricity, and the person might die. So, if there is a direct current DC with a high voltage, like for example, more than 1000 millivolt and 20,000 amperes, it could directly kill a person. Now, coming to filigree burns per se, they're also called as Lichtenberg flowers. Okay, there are the other names include arborescent burns, filigree burns, or keranographic markings. So, in your exam, instead of filigree burns, they could directly give you arborescent burns. Remember, it is one and the same. They're all the eponyms. So, whenever there is a filigree burn, it is pathognomic of a lightning strike. That is, if you see a filigree burn, you have to come to a conclusion that it is a lightning injury that caused the burn. So, what are filigree burns? These are the superficial, thin, irregular touches markings on the skin resembling marbling. So, what is marbling? Marbling is whenever there is staining of the superficial veins that are seen because of stagnation of the blood flow. If the burns look like marbling, then it is called as filigree burns. Okay, they are going to look like the branches of the tree. Because it is going to look like branches of the tree, it is called as arborescent burns. Okay, got it? Next. So these follow a fern-like pattern. So there's going to be branching like trees. As you can see in the neck area here, it is going to look like the branches of the tree, no? Because of which it is called as an arborescent burn. So this arborescent burn is seen in case of a lightning injury. It is found over the shoulder and the flanks, and it is not associated with burning. So the causes are the static electric discharge, which happens during the time of lightning. There could be hemoglobin, which stains the various tissues, which appear as the superficial markings on the skin. And also one of the other reasons is because of the inflammatory response of the body by electrons. So these are the various reasons that could cause a filigree burn. Now, coming to the various MCQs in this chapter, the number one MCQ is, which of the following is a common feature of ante-mortem burn? So remember, in this question, they're asking you ante-mortem. So what did I tell you? Ante-mortem means burn that is happening before the death of the person. So they're asking which is a common feature of an ante-mortem burn. Option number A, no pain sensation due to nerve death. Okay. So we all know that during antemortem burn, the nerves are still active. There could be there could be injury to the free nerve ending, and there is pain. So option 1 cannot be right. Option B, presence of blisters and signs of inflammation. Yes, this could be the answer. Option C, occurrence after death. No. If it was occurring after death, it is called as post-mortem burn. Option D, skin appears dry, charred, without redness. No. In antemortem burn, as I told you, there is vital reaction seen, because of which there is redness. Therefore, the correct answer is option number B, presence of blisters and signs of inflammation. Why there is presence of blisters and signs of inflammation? Because all the metabolic function and the vital reactions still take place, which presence of blisters and signs of inflammation. Coming to the second question, what is the primary factor in determining the severity of a burn injury? The depth of the burn, the color of the burn, location of the burn, or the age of the burn? It was option number A, the depth of the burn. Why? Because based on depth of the burn only, we classify the burns into primary, secondary, and tertiary, based on whether only the skin or the superficial tissues are involved, or if it involves the epidermis, upper dermis, or the lower dermis, we classify the wound. Coming to the next question, the pugilistic attitude refers to, coming option number A, posture common individual from final age. No. Did we start pugilistically? We saw pugilistic attitude in burning. Option A, a defensive posture of fists observed in people after death due to heat or fire. Yes, could be. Defensive posture suggesting that it looks like a boxer. Therefore, it is also called as boxer's attitude. Option C, a position adopted by somebody during physical exertion or exercise. No. Option D, a reaction to a chemical burn injury. No. So the right answer to this question is option B, that is a defensive posture with a clenched fists observed in people after death due to fire. Going to be heat of the the upper limb at the junction of the lower. To the we have number 8, burning or superficial skin layers. No, pugilistic attitude could not be a mild burn, because if there is mild burn, there wouldn't be so much contraction that the person looks like a boxer. No, so option A is wrong. Full thickness burn involving deep tissue damage and body temperature rise could be, because whenever there is severe burn, then there could be a pugilistic attitude that is seen. Option C, chemical burn involving exposure to acids. No. Option D, drowning. No, we did not see pugilistic attitude in case of drowning at all. No, so that should be a immediate. You have to remove that option. Okay, so the right answer for you is a full thickness burn involving deep tissue damage and the body temperature rise. That is option number B, because of which there is going to be flexion at the elbow and knee joint, extension of the head, as well as opisthotonus, where the rule of is nothing but Valley's rule of 9. Option number A, the severity of the burn pain, the extent of fluid resuscitation needed in burn victims. Option C, the depth of burn injury. Option D, likelihood of infection. So what is the right answer? I did not explain this to you, but the right answer for this is option number B, the extent of fluid resuscitation needed in burn victims. So how? I told you that Valley's rule is used in order to calculate what is the total body surface area that is burnt. No? So why do you have to calculate the total body surface area that is burnt? Because based on that, you can estimate how much is the fluid that has to be given to the person in order to resuscitate it. So it is an indirect, it is basically testing your common sense, where you have to understand why we do it. We do it in order to calculate the total body surface, and we do it so that we can estimate how much is the fluid that has to be given to the person in order to resuscitate him. Coming to the next question, which of the following is considered a grievous hurt under the IPC, Indian Penal? options. Temporary loss of vision, no. For a grievous hurt, it should be permanent loss of vision. Option B, permanent loss of limb or a part of limb, yes, could be. Option C, simple fracture of the bone, no. It should be a compound fracture of a bone. Option D, moderate injury causing temporary pain, no. Option D would have been the correct answer if it was more than 20 days. If it is less than 20 days, it is not considered as a grievous hurt. Therefore, the right answer is option number B, permanent loss of a limb or part of the or permanent loss of functioning or temporary loss of functioning of the body for a period of more than 20 days. So these are the various examples for grievous hurt. Coming to the next question, according to the Indian Penal Code, grievous hurt can include. Okay, so this is also a question on grievous hurt. Grievous hurt is nothing but, as I told you, any serious hurt to the person comes under grievous hurt. Coming to the options, any injury that causes temporary pain, no. When you talk about grievous, you have to always remember it is of permanent nature. Option number B, injuries resulting in severe permanent damage such as loss of limb or organ. Yes, this is something that we can think of as an answer. Coming to the other options, minor cuts and bruises, no. Anything minor is not severe, no. Therefore, that is also excluded. Option D, injuries that cause only temporary disability, no. It is permanent disability. Therefore, option number B, injuries resulting in severe permanent damage such as loss of limb or organ. Whenever dowry death, about two things. 304B of IPC, then there is a CRPC that you have to know. So which is that CRPC that is for you to go back and revise. So in under 304B of IPC, a death can be classified as dowry death if, so let us look into the options. A woman dies within 7 years of marriage and is proven to be accidental. No, if it is accidental, it wouldn't come under dowry death. No, so that is not the answer. Woman dies within 7 years of marriage and there is evidence of harassment or cruelty related to dowry demands. Yes, could be an answer. Option C, women dies due to natural causes. No, any natural causes, for example, a heart attack, a cardiac arrest, or any other respiratory illness like COPD, a natural cause won't come under dowry death. Option D, women dies after prolonged illness but not related to dowry death. No, that she is dying because of prolonged illness. No, why would it come under dowry? So the right answer is option number B. The woman dies within 7 years of marriage. So she's going to die within 7 years, and there should be any evidence of harassment or cruelty related to dowry death by either a husband or the income, and it can be considered as dowry death. Coming to the next question, what is the punishment for the dowry death under the Indian law? IPC section 304 of B. Life imprisonment or dowry or death penalty, option number A. Option B, imprisonment for a term which may extend to 10 years. Okay, this seems like a right answer. Option C, a fine with or without imprisonment. No, a mere fine could not be answered, so you have to exclude it. Imprisonment for a term which may extend to 7 years. No, it is more than 7 years. So the right answer for this is option number B, imprisonment for a term which might extend to 10 years. So this is a basic punishment that will be given whenever a dowry death is proved. Apart from it, if the harassment was too much or very violent means was used to kill the lady, like example setting her on fire, then this 10 years could be extended for up to a life imprisonment. So remember, the basic punishment is 10 years of imprisonment, and it can go up to life imprisonment also. Coming to the last question, which of the following is a key factor in determining whether a death qualifies as dowry death? Okay. Coming to the options, the women died within 1 year of marriage. There is proof of dowry harassment or cruelty by the husband or in-laws. The woman was not living with the husband at the time of death. Option number D, the death occurred due to an accident caused unrelated to dowry. So option D you have to exclude. Okay, option D is not at all the right answer because they are clearly mentioning that it was unrelated to dowry. So coming to first option, the woman died within 1 year. No, mentioning what was the cause of death. No, so we cannot take it as the dowry death. It could be because of a natural cause also. Option number B, there is proof of dowry harassment. They are only saying that there is proof of harassment. Then it can act as a key factor in determining whether the death qualifies as dowry death. Therefore, the right answer is option number B. Got it? So these are the various questions that we have to discuss today. I hope you enjoyed the class. So we have covered all the MCQs pertaining to the various topics that we discussed today, so that it will be an active recall of everything that you've studied today. That's all. Thanks for watching. See you with one more topic.